Good afternoon. In today's video demonstration, I'm going to perform the knee routine procedures, which are specifically the AP projection of the knee and the lateral projection of the knee, or the mediolateral projection of the knee. Good afternoon po, ma'am.
Sir.
Please sit down po.
Thank you.
So, good afternoon again, ma'am. I am John Ikoy, and I am your RadTech for today. And I just want to ask, ma'am, if what is your language preference for...
Bisaya, sir.
Sige. Noted po, ma'am. Ma'am, mautala ko, ma'am, sa inyong middle name, age, and your date of birth for confirmatory lang ni ma'am if I have the right patient.
Fulgo, sir, ako ng middle name, then 17 years old po ako, then August 3, 2003 po akong birthday.
Ma'am, mautala ko, ma'am, if ni man ni ma'am no sa right,
Opo.
tama ba? Naong sa day na gay, ma'am, imong ni?
Pag abak na ko, sir, ba na igo ganit sa bakal akong tuhod.
Pero malihok pa ni mo, ma'am, ang
Opo.
tuhod.
Yes,
Reflex
sir.
daw, ma'am. Okay. So, kailan lang. Ma'am, pregnant ba ka, ma'am?
Dili, sir.
Kano sa kalas gidugo, ma'am?
Last month lang po.
So, ma'am, before ito mag-proceed sa atong procedure, ma'am, nagalo na to atong mga any metallic objects na nasa ato ang kuan na mag-obscure sa knee nato sa kuan. Then, natay patient gown dito, ma'am, sa atong dressing room. Pwede din mo to siya gamiton, ma'am. And mag-introduce ko po sa imuha og mga lead shields, ma'am. Kani, ma'am, sa gonads ni siya ibutang, ma'am, sa imuhang reproductive dili na siya ibutang, ma'am.
Okay,
Then,
po.
para maprotektahan imong ovaries, and kani, ma'am, is sa imong thyroid. Then, ma'am, pwede ko mo gunit, ma'am, ibutang ako sa imong liog.
Okay.
Kani, ma'am, sa imong thyroid, dili ni sa imong kuan, ma'am, ha? Since, baka lakaw, baka, ma'am, kuan?
Opo.
Sige. Kung since ready na baka, ma'am,
Ready na po, sir.
sige, mag-proceed na to sa mga procedure, ma'am. So, ali, ma'am. Ma'am, please lie po, madali, ma'am. Igda, dali, ma'am, sa atong table. Right knee, man to, ma'am, no?
Yes po, sir.
For today's video demonstration, I'm going to demonstrate first the AP knee projection. So the technical factors for this is 10 by 12 inches na IR, SID of 40 inches or 40 inches. Then this procedure is a non-grid since it does not exceed, the tissues does not exceed with 10 centimeter. So first is inpatient positioning. Position the patient in a supine, and the unaffected leg or knee is on the back of the or behind the affected side of the knee. Since our patient is affected side is ang right, so we place the IR. Ma'am, butang kong IR, ma'am, ha. Then, ensure that the patient knee is in true lateral position. So to check that one is you need to check if the femoral condyles and is in lateral through AP. So next one is instruct the patient to rotate his or her leg 3 to 5 degrees internally para ma-straight, para we can achieve the true AP position of the knee. So, ma'am, i-rotate na ko imong leg, ma'am, ha? Anak, ma'am. Anak. So, since na siya, rotate na siya, since true AP na siya ang position sa atong knee sa patient, then the central ray must be So the central ray for this procedure is it enters to the point of 1/2 inch or 1.3 centimeter inferior to the patellar apex. So to locate your patellar apex is you need to palpate the patella. So what happened? So inferior to the patella. So this is the patellar apex. Then inferior for 1/2 inch or 1.3 centimeter. So the central ray must be directed here. So before exposing the patient, adjust the leg so that the femoral condyles are parallel to the IR. So these are the femoral condyles. So as you can see, it's parallel already. So this is a true AP position. So depending on the axis to the tabletop measurement, direct the central ray as follow. So there are 3 ways to direct the central ray. For less than 19 centimeter, 3 to 5 degrees caudad if the patient has a thin pelvis. 19 to 24 centimeter, 0 degrees, so there should be no angulation for this one. Greater 24 centimeter is 3 to 5 degrees cephalads or large pelvis. So I've already measured the pelvis of the axis of the patient. It belongs to the 19 to 24 centimeters. So there will be no angulation for this angle, the central ray. So to demonstrate the central ray, again palpate and the apex of the patella, then 1.5 inch. So dito natin isa-center yung central ray. And then do not forget to put your lead marker. Since right ang affected side, put it and make sure that it does not superimpose with the anatomy being the anatomy of interest. So instruct the patient to do not move. Ma'am, ayaw bihok mama. And make sure that in collimation, you include the 1 inch or 2.5 centimeter beyond the sides and place side marker in the collimated exposure field. So you include the distal femur and the proximal leg. Or so, ma'am, I hook ma'am, then shoot. For the structure shown for AP knee projection, as you can see, we can the femur, patella, the lateral epicondyle, the intercondylar eminence, the fibular head, the tibia, the tibial condylar margin, femorotibial joint, the intercondylar fossa, as you can see here, the patellar surface, and the medial epicondyle are clearly demonstrated in this procedure, which is the AP knee. So in critical criteria evaluation for this one, for AP knee projection, the femoral epicondyles are in parallel and the femoral condyles are symmetric. So as you can see that the epicondyles of the femur are symmetric with the femoral. Then the intercondylar eminence is centered within the intercondylar fossa. As you can see here, centered. The tibia superimposes 1/2 of the fibular head. As you can see that the 1/2 of the fibular head are superimposed with the tibia. The patella lies just proximal the femoral patellar surface and it's slightly lateral to the knee midline. As you can see, the patella here. The knee or the femorotibial joint space is open. As you can see, the femorotibial joint is open. Anterior and posterior distal tibial margins are aligned, as you can see on the radiograph. The fibular head is 0.5 inch or 1.25 centimeter distal to the tibial plateau. So this is one. Then the knee joint or the femorotibial is at the center of the exposure field. As you can see here, centered at the exposure field. The 1/4 of the distal femur and the proximal lower leg and the surrounding knee soft tissues are included within the exposure field. The next procedure that we're going to demonstrate is the lateral knee projection. So in lateral knee projection, the technical factors are the same with the AP knee. So we use the IR size of 10 by 12 inches and the SID 40. So in patient positioning, position the patient recumbent on the affected side. Since the affected side is in right, so ma'am, tagilid ta pa right, ma'am. Makaya ni mo, ma'am. Bulit ko, ma'am, ha. Straight ta, ma'am, sa atong table. Ana. Then, kayong tiil, ma'am, sa behind mo, ma'am. Ana na, ma'am, to place support siya. And then, put the IR here and instruct the patient to flex his knee or her knee 20 to 30 degrees and center the IR knee joint just below the patellar apex. So, ma'am, flex na to 20 to 30 degrees ang knee, and ensure that the center of the IR is centered on the apex of the patient. So, ma'am, lie down pa, ma'am. Tagilid pa, ma'am. Para matulo lateral. Make sure that the femoral condyles are parallel to the IR, ma'am. And make sure na naka flat surface na ang condyles. Then, since na-center na nato siya, the central ray must be angled 5 to 7 degrees cephalad entering the knee joint 1 inch distal to the medial epicondyle. So to demonstrate that procedure, the central ray, so 5 to 7 degrees caudal. So here. Then, make sure na center na siya. And then, collimate on the adjust to 1 inch or 2.5 centimeter anterior to the patella and 1 inch 2.5 centimeter beyond the posterior shadow. Then place the lead marker on the right side. So you can see, and make sure that it does not superimpose with the anatomy of uterus. Then instruct the patient to do not omit any movement. Ma'am, ayaw ulit, ma'am, ha. Shoot na ta. Then, shoot. In the structure shown for lateral knee projection or mediolateral projection, as you can already see clearly demonstrated the patella, the patellofemoral joint, which is here, the femoral condyles, the femorotibial knee joint, as you can see here, the intercondylar eminence, the fibular head, the neck of the fibula, the shaft of the fibula, the tibia, are clearly demonstrated for lateral knee projections. For criteria evaluation for lateral knee projection, the contrast resolution is adequate to demonstrate the suprapatellar fat pads. As you can see here, these are the fat pads. So, makita siya. The patella is situated proximal to the patellar surface of the femur. As you can see here. The patellofemoral joint is open. As you can see, the patellofemoral joint is open. The distal margins of the medial and lateral femoral condyles are aligned, as you can see on the radiograph. The fibular head is 0.5 inch or 1.25 centimeter distal to the tibial flat 2 can be clearly seen. The knee joint space is open. As you can see, this is the knee joint space, open. The anterior and posterior margins of the medial and lateral femoral condyles are aligned. Tibia superimposes one half the fibular head, as you can see here. The knee joint is at the center of the exposure field. Here, the knee joint. 1/4 of the distal and femur proximal lower leg and the surrounding knee soft tissues are included within the exposure field. Ma'am, done na po atong procedure and i-remind lang ta ka ma'am na ang result ay ma'am is 2 to 3 hours po siya bago makuha. And ma'am, pwede na ka mag-iis ma'am and pauna na ko ng mga lead shields po natin ma'am. Yung nasa liog, assist na lang ta ka ma'am sa pagkuha. Then ang ato ang paki-hanger lang sa hamper ato ang pan ma'am ha. Ato ang patient gown ma'am ha. Ito ma'am. Sige, thank you po. Thank you sa
Thank you,
communication.
sir.
Pagpaminos akong instruction.